Hello, Washingtonians. My name is Asia Sneed, and I am a graduating senior nursing major. You are tuned into the podcast Healing Beyond the Hospital, a semester in community health. Today, we will be dissecting my experience in community health at Howard University. We will dive into the importance of public health nurses and their impacts on vulnerable communities and the ways in which they continue to positively impact the health of populations. First, I will be touching on Mary and her family's story. In the video, There's No Such Thing as Small Stuff, Being Poor in Louisville, Mary discusses how her family with 3 teenagers has to make critical decisions in order to survive on a budget of $120 to $175. What stood out most to me was how financial insecurity forced Mary to constantly choose between her family's nourishment and basic necessities. Miss Mary explained how she is presented with the decision to make food choices such as frozen meals instead of fresh produce in order to accommodate for utilities. These stressors continue to negatively impact their physical and psychological health. This has led me to reflect on my clinical experience at the Hayes Senior Wellness Center. Serving these communities taught me that social determinants of health have an immense impact on health ideology and reality. Health outcomes are shaped long before someone steps into a clinic. They are dependent on the community's resources, such as grocery stores, access to green spaces, and health literacy. Deficits in these areas lead to chronic stressors and poor health outcomes such as long-term illness, early aging, and mental health issues. It was also shared by the U.S. Department of Health and Human Services in their Healthy People 2030 that there are higher rates of chronic disease in low-income, food-insecure adults between the ages of 18 and 65 years old. Nurses in the public health setting don't just monitor blood pressure and blood glucose. They build trust, create safety plans, brainstorm education methods, and advocate for policies that reduce health disparities. They serve as a bridge between the underserved and health systems who want to positively impact others. Their presence ensures that being a vulnerable person in a community does not mean you're being overlooked. Before this course, I had a limited view on the career paths of nurses. I was mostly familiar with the nurse's bedside role, and now I understand that nurses do so much more than that. Nurses means fighting for food access, housing security, and mental wellness. This comes in the shape of school nurses, home health nurses, and public health policy nurses. This course has equipped me with the mindset and skills needed to step into communities with confidence and compassion. This course has equipped me with the mindset and skills needed to step into these communities with confidence and compassion, addressing effective communication, culturally appropriate care, interprofessional collaboration, and preventative measures needed to sustain life. One of the biggest opportunities given in this course was our windshield survey. This is when we were able to go as a group into a community and see what was truly affecting these people. As stated by Stanhope and Lancaster in 2025, a windshield survey is a helpful first step in understanding the potential environmental health risk in a community. After conducting my windshield survey assignment, I now find myself conducting them internally in different communities I explore and engage within. I noticed food deserts, limited clinics, and the absence of safe spaces for children and adults. This course taught me to look beyond the surface and recognize the deeper systemic issues that present and impact health every day. It has sparked my awareness of health disparities and reinforced my motivation to become an advocate for marginalized communities, especially in the greater Washington, D.C. area. My firsthand experiences will stay with me for a lifetime and serve as a guide for continued growth and improvement. Moving forward, I hope future nurses can gain just as much as I gained from this course. I hope future nurses at Howard can embrace the idea that their voice and action truly do matter. Empathy and advocacy are essential tools in this line of work, and they must be paired with real-life data, cultural awareness, and strategic clinical practice. Nurses have so many skills, and they play a critical role of not only treating illness but preventing it through our different prevention methods. By preventing illness, you're addressing the root causes. You're navigating resources and recognizing the barriers that patients face, such as limited health literacy and limited transportation. Nurses also must conduct interprofessional work, leaning on those around them in order to lift those they want to serve. Leading with this compassion can be the foundation of change for improved health. Public health nursing is a promise. It's a promise to care for every part of a person's life, such as a holistic point of view. They address the unique social determinants of health within the population. This includes your education, your work, your access to food, your access to healthcare. In order to do so, you have to think outside of the box and use your resources to the best of your abilities. I hope others are able to gain what I have gained from this course and also apply it as they move forward, just as I hope to do. I now know that my passion for nursing comes with a big responsibility to serve those around me and just allow me to be a better person. I thank you for listening to the Healing Beyond the Hospital, a semester in community health nursing at Howard University. I think you now know that nurses aren't just by the bedside, but they do much more than that. I hope you can gain from it a drive to make a change within your community and continue showing up, speaking up, and serving the public with a truly divine purpose. And I hope you had a great time listening to this, and I hope you have a good night.